Now, the signs were there that may have prevented the tragedy in Tucson, but the alleged shooter never got treatment for mental illness. Now, Oklahoma officials fear it could happen again, maybe even closer to home. Our Jacqueline Sitt joins us to explain. Jacqueline?
And Amanda, health officials say Oklahoma has one of the highest rate of mental illness in the country. They also say the ability to fight it is getting tougher and that long battle could lead to worse consequences.
We have to be perfectly clear. Anytime you have untreated mental illness and addiction, there is a chance of a tragedy like this occurring here in Oklahoma.
Commissioner Terry White with the Oklahoma Department of Mental Health says the number of those with untreated mental illness is staggering. Right now, there's a huge gap of people needing help versus those who can get it.
We have waiting lists every day of hundreds of Oklahomans who've asked for help, who qualify for services, and all the programs are full.
Facilities such as the OSU Psychiatry Physicians Clinic and Norman's Alcohol and Drug Treatment Center have been cut due to budget constraints. Now, another fiscal year is ahead of the Oklahoma Department of Mental Health, and officials are asking for more money to help Oklahomans in need.
If we want to help ensure all kinds of good things, we want to ensure children are graduating from high school as opposed to dropping out. We want to ensure families are staying together. We want to ensure that we have a good, healthy workforce who's at work, employable, so that we can have good economic development.
The bottom line, what may prevent a tragedy in Arizona here in Oklahoma is going to take the destigmatization of mental health before it can do any good.
We know we've seen increases in the number of calls coming into the suicide hotline. We know people are struggling and need help, and we're losing those services right now as opposed to putting more in place and doing earlier interventions with dollars and resources, and we've got to start investing there if we want to prevent these types of tragedies.
Now, Commissioner White will be in a budget meeting with the governor tomorrow, and she'll be requesting $130 million for the year. Amanda?
Okay, Jacqueline, and if you need information on mental health resources in our area, we have it posted for you on our